Welcome guys, back to another video. Today is a bit of a different one because today we're revising calcium homeostasis. We're going to go through a few different things. Firstly, what calcium does to the body. Then we're going to talk about the hormones that control it, a few of the cells that also control it, topping that off with what diseases can be caused by its dysfunction. Then, finally, talking about its treatments. And last but not least, the dietary sources of calcium and vitamin D. Please remember, this is not medical advice. This is revision focused around pharmacy. Please consult a physician or any qualified medical professional before making changes to your diet. This is more of a revision session for me, and I am liable to make mistakes. Okay, let's talk about what calcium does to the body. Firstly, calcium is responsible for muscle contraction by binding to a protein called troponin. Troponin acts as somewhat of a firing cap on the two main muscle proteins, actin and myosin. When calcium binds to troponin, it moves, allowing actin and myosin to bind to each other and begin a muscle contraction. Therefore, calcium causes muscle contractions. Calcium also is responsible for nerve signaling and is the main mineral in hydroxyapatite, the mineral which makes up your teeth and bones, along with phosphorus. As you can see, calcium is very important. However, it must be tightly controlled. Too much or too little can be fatal. Calcium concentration in the blood normally hovers around 2.2 to 2.6 millimole per litre, at least in adults. Too much is called hypercalcemia. Hyper meaning high, calci meaning calcium, and emia meaning presence in blood. Similarly, hypocalcemia, hypo meaning low, calci meaning calcium, and emia meaning presence in blood. So, now we've got that all out of the way, let me introduce you to some of the characters that remodel your bones, and then I will talk to you about the three main hormones responsible for controlling calcium. Firstly, osteoblasts are pretty simple. They are specialized cells that can be remembered with the simple phrase, blasts are the builders of your bones. And in this case, they take calcium from the blood, as well as a few other minerals and chemicals, and use it to build the structure of bone. Osteoclasts, meanwhile, are specialized macrophages. Macrophages are a type of immune cell known for eating things. Similarly, osteoclasts break down bone and recycle its contents into the blood. Remember this, clasts cleave, blasts build. Your skeleton is constantly being remodeled throughout your life. Most people go through several of the things by the time they die. Okay, let's move on to the hormones, one of which you already know as vitamin D. Yes, vitamin D is actually a steroid hormone. It is responsible for telling your gut to absorb more calcium. Next up is parathyroid hormone, released by the parathyroid glands right behind the thyroid gland, located in your neck. Parathyroid hormone does a few different things, but its main job is to increase calcium concentration in the blood, and it is released when calcium concentration is low. It first inhibits osteoblast activity, preventing them from taking the calcium out of the blood to build more bone. It then increases osteoclast activity, telling them to break down more bone and secrete it into the blood. And then, finally, it increases calcium reabsorption in the kidneys, telling your kidneys to conserve calcium rather than pee it out. Next, and finally, calcitonin, because calcium is in. Calcitonin is released when calcium is too high in the blood, and it stops the kidneys from reabsorbing calcium, encouraging them to pee it out. Secondly, it inhibits osteoclasts, stopping them from putting more calcium into the blood, and thus, because there is more osteoblast building than osteoclast destroying, you get a net gain of calcium in the bones and a net loss in the blood, and thus a reduction in blood concentration of calcium. Okay, Now I've told you about the main hormones that control calcium concentration. let's see what happens when things go wrong. First up is osteoporosis. There are a few different causes of this, calcium and vitamin D deficiency being the most common, but there are a few others, such as the menopause, where the lack of estrogen, which normally opposes the action of parathyroid hormone, will then cause bone loss and the loss of bone integrity. Certain drugs, like corticosteroids, when inhaled or taken orally, can decrease bone mineral density, and certain endocrine disorders such as diabetes, Cushing's syndrome, and hyperparathyroidism can cause osteoporosis. Osteoporosis can be explained by something called T-scores. These are a standard unit that typically you'd want to be in the range of 1 to -1, and they measure your bone mineral density. If your T-value drops lower than -1 but greater than 2.5, you are then diagnosed with osteopenia. If it gets worse than -2.5 and is associated with a fragility fracture, you are diagnosed with osteoporosis. According to the NICE guidelines, the most common way to treat osteoporosis is lifestyle modification, such as stopping smoking and drinking alcohol, and often supplementation, which means 1,000 milligrams of calcium and 400 units of vitamin D a day, which are given usually as tablets. Another way is through resistance training, commonly the form of lifting weights. This applies a force to the skeleton and encourages osteoblast activity. Blasts are builders, remember. The other drugs which are used include drugs called bisphosphonates. Think of bisphosphonates like zoning or planning permission. They slow the rate of building, but they also slow the rate of destruction. One very common drug used in this class is alendronic acid, which is usually taken once per week. There are a few important things to know about alendronic acid. It should be taken 30 minutes before breakfast with a glass of water, and the patient should stand upright 30 minutes after taking the tablet. This is to avoid gastrointestinal side effects such as esophageal or stomach ulcers. There are other rarer side effects of bisphosphonates such as osteonecrosis of the jaw, which is something to keep in mind. There are a few other more niche drugs that we don't have time to get into today, such as strontium renalates, raloxifene, and sometimes HRT is given off-label. If you remember back, one cause of osteoporosis can be the menopause and the loss of estrogen, and thus temporarily replacing the estrogen can delay these effects and is used normally off-label. Okay, as previously stated, calcium is really important in muscle contractions, including the heart muscle and the smooth muscle in your veins and arteries. Thus, if calcium rises too high, blood pressure will increase, and so will the risk of arrhythmias. If calcium falls too low, blood pressure decreases and can also cause heart arrhythmias. Heart arrhythmias are erratic heart rhythms and can be incredibly dangerous. Similar to how the thyroid gland can be affected by hyper or hypothyroidism, so can the parathyroid glands. In hyperparathyroidism, too much parathyroid hormone is released, causing hypercalcemia. Remember, hyper, high, calcium, emia, presence in blood. This is treated with surgery and a few different drugs like paracalcitol. In hypothyroidism, damage to the parathyroid glands causes too little parathyroid hormone to be released, resulting in hypocalcemia. This is treated with drugs like calcium gluconate, which is a replenishment source of calcium, and vitamin D supplementation, as we try and push as much calcium into the body. Next up is Paget's disease, a genetic disorder that causes bones to be larger and more brittle due to excessive osteoclast activity. The osteoclast cleave, and the osteoblasts attempt to rebuild the bone. However, they don't do a good job, leading to the bones becoming larger and more brittle. This is treated with drugs like salmon, yes, salmon, calcitonin, and bisphosphonates once again. When cancer spreads to the bone, it can cause it to break down, leading to hypercalcemia. And thus, often these patients are given bisphosphonates to slow the rate of bone breakdown. Next up is vitamin D. Vitamin D, when it's too low, causes osteomalacia in adults or rickets in children. This is characterized by softer bones leading to bowing of the legs. This is commonly caused by malnutrition and is treated with supplementation. If vitamin D is too high, which is rare, however possible due to vitamin D being a fat-soluble hormone and vitamin, which means that it's not excreted as well by the kidneys. In this case, you'll get skin problems and hypercalcemia, and is treated by the stopping of any vitamin D supplements that you are giving to this patient. Okay, last but not least, let's talk about dietary sources of both vitamin D and calcium. Sources of vitamin D include fatty fish, fortified products, egg yolks, and mushrooms that have been exposed to sunlight. Dietary sources of calcium, meanwhile, include milk, dairy, broccoli, and spinach. Alright, that is everything. I hope this has been informative, and hopefully this can help me in my revision. Thank you very much for listening, and I would really love to hear anyone's feedback on basically anything to do with my current setup and anything I could do to improve. And anyway, have a good day.